Class? Yes, you
I guess I could do it.
I heard that she was.
Okay, yeah, yeah, Friday. Good morning. Don't forget about these announcements up on the screen. Things coming up this week, and a new one up there is that this is registration week, when you register for classes. If you're a senior and you're graduating, you don't need to register for classes, but everybody else should be registering for classes. Another announcement is that I am recording this morning for somebody that has to be absent. And if you know that you're gonna have to be absent coming up, let me know and I can record class for you also. So what we're gonna do this morning is start with lecture and then we will stop a little bit before the end of class and go over exams for the end when I am not recording. So your lecture exams, I put those grades in on Canvas. Lab exams will be getting back tomorrow. Going over those a bit tomorrow. Danny still has those, and I'm curious to see how those came out. I'll see mine too.
I was just gonna
And also remember, if you are interested in the meeting with a pharmacy representative, so if you've been following human bio track or exercise science kinese track, those both get you pretty close to what pharmacy requirements are. So if you want to meet with them, you're allowed to miss some lab to do that. Just let me know that you plan to do that. So let's get started on kidneys and urinary system. Here's your quiz answers of the day. Here.
My picture did not pop up.
Oh.
Yeah, mine didn't even on that.
Yeah.
Probably still could guess that from the words, but I will keep an eye on that so every time when I go and adjust quiz grades, I kind of look like, does this look like a normal set of quiz grades, or does this one look like something went wrong? I'll keep an eye on that. But thanks for letting me know. The answer is nephron. So we're going to start now talking about kidneys. And kidneys actually are somewhat related to respiratory system and blood composition and blood chemistry. They're very related to all of that. So it kind of sits in the middle of this unit. And the major function of your kidneys is to filter blood, is their number one function. If people have failing kidneys, they will often need a procedure called dialysis or kidney dialysis. I'm not going to play this video right now for sake of time, but you may have people you know who have failing kidneys and have to go for dialysis, and it's very time consuming. and very important that they do that, because if your kidneys are not working to filter blood, you will slowly end up with toxic chemicals in your blood and almost poison yourself. So one important fact to keep in mind about the kidneys is that they have a huge blood supply. They have a really huge blood supply, and a lot of branching of the blood vessel networks because of their job of filtering blood. So their major function is to filter blood, but they have some other important functions as well. And all of these things we will be looking at, how do the kidneys do this in this unit. So these statements are kind of talking about three big overall things that the kidneys do, and this one is the filtering. This one really is getting the waste out of the blood, doing the filtering. The one at the top is to, another way you could say this is to regulate plasma balance. So beyond just filtering waste out of the blood, the kidneys also help control what's in your blood, specifically what's in the plasma. So how much plasma, what pH is it, and what other chemicals that stays in the plasma. Your kidneys do that. And then this section is kind of a catch-all category of other things the kidneys do. So by doing this, your kidneys control your blood pressure, which is a big deal. By balancing your sodium and calcium levels in the blood, that's maintaining plasma composition. And then they also have a role in helping you make red blood cells indirectly. So kidneys do all of those things, all really important to body function. So you probably now, I hope you have, seen where the kidneys are on the torso models. And you guys had on the lab exam renal artery. Renal arteries bring blood to the kidneys, and they're not shown here, but you should have two kidneys, and they are kind of upper back abdominal region. So they sit toward the back, up under the ribs, and when you see MMA fighters or boxers punching up under the ribs, they're trying to punch each other in the kidney, which is mean but effective as a way of disabling someone in a fight. So they're up against the back torso wall, tucked up under the ribs, and usually the left one is a little bit lower. That's normal. So your kidneys filter blood, and what comes out of the blood goes into the urine. Your kidneys are urine producers, and these are the major things that ought to be in healthy urine. It ought to be mostly water, of course. 95% water. And the other 5% will come from these type of chemicals. So we ought to have wastes in the kidneys, including these three major types, something called urea. That's where the word urine comes from this urea chemical. And we make urea every time we break down dietary protein. So if you eat protein, you're making urea, and you need to get rid of it in the urine. There's a second chemical called uric acid that's also normal in urine, and it comes from if we're metabolizing DNA and RNA. Uric acid is a waste product from that. And the third one is creatinine. How many of you all have learned about creatinine in another class. Where'd you learn about it? What is it?
Well, I remember like hearing about it and that, like back in high school.
Oh, okay.
It was like,
Somebody else had heard of it. Kind of makes sense. I think this is more of an exercise physiology topic, but creatinine, I forgot to put in the black words here. Creatinine comes from muscle breakdown / renewal. So all people who are living have some level of creatinine waste product in their blood that comes from muscles repairing themselves or muscles renewing the proteins in the muscle fibers. If you do more intense exercise or if you're trying to build muscle intentionally, you'll have more of this creatinine product in your blood. So it's normal to have it. It varies how much people have of this chemical, but the other important thing about creatinine is that we can use it as a measure of kidney function, something called GFR, which we'll get to in a bit. So GFR is a measurement of how well your kidneys work, and that tends to use creatinine measurements to determine how well are your kidneys working. And then normal urine will also have some amino acids in it and some electrolytes. That's normal. This is what should be in urine. There are a lot of things that can be in your urine that shouldn't be there. We'll talk about those in a bit. So your kidneys are up here toward the back, under the ribs. They're filtering blood. They're filtering, hopefully, this stuff out of the blood and into the urine. And the urine that they make is going to drain from the kidneys down through the ureters, which are here, and into the bladder. And ureters are pretty long, and we tend to not usually think about them, but they're carrying urine toward the bladder. And in an average height person, they're about 25 centimeters, which is pretty long. Mine would not be that long. No way. That's the average. And the ureters kind of come and join the bladder down in the pelvic cavity, which maybe is kind of obvious. And the only time that we tend to think about ureters is if something's going wrong with them, in that they have a kidney stone stuck in them. Technical term for kidney stone is renal. So this is a word that means kidney, calculus for stone. So kidney stone, renal, calculus. And when people get kidney stones, their urine is too concentrated up in the kidney, and crystals start to form in that concentrated urine, and then they get stuck somewhere along the path. Kidney stones. Thinking about 3 years ago, I had a student in fall A&P, and she had a kidney stone the whole semester, and it would move like 1 centimeter per week or something. Amber. The whole semester. Took it forever to move. Okay, so now we're going to look at bladder. So here we've got ureters coming down, and these holes at the bottom, sort of toward the bottom of the bladder, that's where the ureters join. So I had kind of imagined, oh, like, yeah, ureters, they come in the top and the urine would rain down. And it kind of fills from the bottom up, which is interesting. Whoops, wrong way. Okay, so most of your bladder composition is muscle, and the walls of it are mainly smooth muscle, and it's a special type called detrusor muscle. So you might remember from AMP1 that The bladder also has something called transitional epithelium that stretches. So as urine comes in and fills up the bladder, it can stretch and fill up. But then the muscle in the walls will eventually start to contract when the bladder fills up. And that's when we feel like, oh, I have to go. Feel the contraction. And we have a couple of different valves or sphincters associated with the bladder. And the first one that is right at the neck of the bladder is called the internal urethral sphincter. So here we've got this tube that carries the urine to the outside of the body. That's urethra. And there's a sphincter here called internal urethral sphincter. And that one is involuntary. That one, we cannot decide to open it or shut it. So this one, I'm talking about the internal, opens at a certain fullness level. And when our brain senses that, we sense that as the urge to go. When that sphincter opens up, and it tends to open up when you have a certain weight of urine pushing down on it. So little kids, it's a small weight. Grown-ups, it ought to be a greater weight, but this will open according to fullness, and when it opens, our brain should sense it and let us know, oh, I have to go, I have the urge to urinate. And that's where the second sphincter comes in, which is lower down. This is the external urethral sphincter, and you can see here there's muscle bands that can tighten around this. This is the one we can decide to squeeze it or relax it. It's voluntary, but yeah, it's voluntary, but the control of this has to be learned. Control of that has to be learned. And that's, when you're a little kid, that's potty training. When we had our first son, Noah, I was trying to potty train him. I was very frustrated by it, and I asked my mom on the phone, like, how she did it with us, me and my brother. And she said, I don't even really remember. And it made me so mad. I was like, how can you not remember? This is my whole life right now. But now also I'm starting to forget. So people tend to learn this when they're young. The other time when people have to learn this is if they lose control of this when they're older because they have some type of trauma or a stroke or something happens. So physical therapy, occupational therapy, you would be surprised how many people need to relearn this. They just don't like to talk about it. So what do you call it if people have lost this ability? What do you call their problem? Incontinence. Yeah, it's a good word to know. So this incontinence is when you have lost the ability to control this sphincter, incontinence. So now these are my least favorite pictures in the OpenStax book. I think they actually have improved in the new edition, but what we've got here is sagittal, or this way, section of female bladder anatomy and male bladder anatomy. It's a little bit grainy. But it's kind of showing where does the bladder sit in men and women. And in women, the bladder is under the uterus, which is important during pregnancy. So here's uterus, here's bladder. In males, there's no uterus. There is nothing really to push down on the bladder. But in males, the bladder is on top of the prostate. Yeah, prostate gland sits under the bladder, which is hard to see here. But those positionings of uterus and prostate have a lot to do with bladder issues in men and women. So in women, if they are pregnant, a pregnant uterus is going to push down on the bladder and cause women to have to urinate more frequency during pregnancy. So you can imagine, you know, if this sphincter is controlled by weight above it, it's going to open up a lot more often the further you proceed through pregnancy, which is annoying. And then, you know, you can still control this sphincter, but you have less time in between. So that's the female situation. The male situation is kind of opposite. Kind of opposite because there's nothing pushing down. There's something underneath that could enlarge. So with men, their issue tends to be prostate enlargement. Prostate enlargement. It's not that big enlargement. So if men have prostate enlargement, that's going to squeeze the urethra so that it's hard to fully drain the bladder. So right under here is prostate. Prostate enlarges, it kind of pushes in on the urethra and it makes it hard to get all the urine out of the bladder or to fully empty it. So older men that have prostate enlargement have also frequent urination, but it's just for a different reason. When they do go, they can't get it all out, so they end up going often. So do pregnant women, but it's two different reasons for that. Position of the bladder. Okay, so here we've got female bladder, male bladder showing ureters, bladder, prostate in the male, penis in the male. But the point of this is to show what's the length of the urethra. Female urethra is about 4 centimeters, so not even as long as your little finger, maybe 2 joints of your little finger. It's female urethra. Male urethra is 20 centimeters, and that length difference accounts for most of the reasons why women get more urinary tract infections than men. Because UTI, I'm trying to remember, UTI. Because of this. So UTIs, in some way, are going to require microbes to colonize the bladder. So microbes that can live off of urea as a food source would love to live in the bladder because it's like a paradise of food for them. If they're going to colonize the bladder, they're going to be coming from outside the body and swimming up the urethra. You're going to have to swim up the urethra to get there. And in women, it's just a really shorter distance than in men. In women, if you can make it 4 centimeters, you can reach the promised land of the bladder. In men, microbes would have to swim 20 centimeters to get there, and it's just much more difficult to make it that far. So that's the reason why women get more UTIs. I asked this on a test one time, like, question is, why do women tend to get more UTIs than men? And there was one person, all they wrote was tight pants. I thought, I'm gonna lose it right now for like many reasons. Number one, were you even in class? Number two, guys can also wear tight pants. It's not, yeah.
Well, wasn't there something where it's like, if you're wearing like tight pants or like something tight, like around your burn area, it has to be breathable?
Yeah, so tight pants would contribute, and high moisture levels would contribute because microbes on the outside, let me get a different picture to portray this. Okay, so most microbes that colonize for UTI are coming from fecal material. And the warmer and the more moist it is in an area, the more they are going to be able to live out on the surface temporarily. So breathable, this is true what you're saying, like breathable, loose fitting clothing, if people are prone to UTIs, you need to go that route because it will reduce how many microbes can live externally on the skin and have fewer chance of them getting toward the urethra and fewer to start the swim journey up the urethra. Does that make sense?
I just remember like, I don't know if the whole thing was, where it's like, don't wear leggings for like this amount of hours or like they're gonna UTI.
It increases the risk. It's not like gonna cause it. If that makes sense. Yeah, but you know, if you get sweaty in leggings, it would be good when you get a chance to take them off and take a shower. But it's not something to like, really worry about a lot, I would say. If you have, you know, decent, basic daily showering hygiene, which hopefully you do at your age. We have one child we're working on that with. Did you take a shower today? Oh, well. Did you put on deodorant today? No. Please do it. Please do it. So when we feel the urge to urinate, there are several things that happen that lead to urination. So we start with filling up. There is a stretch. Your brain senses it. You feel like you need to go. You hold it probably until you can get to a toilet. Then you relax the external sphincter and so on. This stuff is not super important for you to know for this class, but if you later are going into physical therapy or occupational therapy and you come back through these notes, this is going to help you. And that reminds me, really all of you should keep notes from this class if you are going forward to any type of graduate work. Because I try to make the notes useful for like not too long and hitting the high points, and it will help you when you're studying for your next graduate school thing. So please do keep these notes. Oh, one more thing. Urination on purpose is called micturition. Micturition, that's what that word means. Release of urine on purpose. Sometimes people mix it up with mastication, which is chewing. They're different. Different words. Okay, so to kind of go back and talk about other things that could go wrong with urination, one of those is kidney stones. excuse me. So when you have a kidney stone, it's going to tend to get stuck somewhere between the kidney and the bladder, coming through that thin ureter. That's where they tend to get stuck. And when a kidney stone does get stuck there, your ureters have muscle in the walls, and they will try to push it through and make it do peristalsis. So remember, peristalsis is when you've got muscle contractions moving something forward. And so you'll have peristalsis waves in that ureter, and every time you have one, it's going to hurt. That's if you ever had a kidney stone and you feel like the pain comes in waves, that ureter is trying to push that kidney stone forward, and every time it does a squeeze, it's going to hurt. Whichever ureter is having the kidney stone, the kidney on that side is able to sense it, which is cool. And that kidney will make a little bit less urine for as long as the stone is stuck on that side. So the other kidney tries to take over somewhat, and you'll have more urine coming out of the good side than the side that's blocked up with the kidney stone. And they are super painful. So yeah.
My sister, she's had a lot of these, and she says like the pain feels like really bad, like cramps, like on your period. Would that be because like your uterus like on top of your bladder?
Yeah, go back to our favorite blurry picture here. So pain that's coming from bladder and ureter would be using the same nerve networks as pain that's coming from uterine cramps. And this is called referred pain. And your brain gets confused about where it's coming from certain times. So the same, like if you're having a heart attack and you feel like your left shoulder hurts, your brain is not quite sure where that's coming from. And it's like, well, it's this general area, or well, it's this general area. And it can feel like menstrual cramps, even though it's a ureter cramp. Oh, I know what I was going to say. Did I tell you about Professor Rudd and the kidney stone? This is my favorite Professor Rudd story. So about 6 years ago, he called me one morning and said, can you drive a van for Gym Bio 2 field trip today? And actually I could, which is kind of miraculous. I had time. I said, yeah, I can. He said, I have a kidney stone and I think I can go on the trip. I just shouldn't be driving the van. I was like, okay. So I drove the van. He's riding up there with me, and like every so often on the way there, he'd start like sweating. He was just suffering so bad. And then we got to the place, and he's leading the class around and doing the field trip. He had a kidney stone. He just canceled the whole thing. This just shows what kind of person he is. He's actually very tough. I don't think he's had many kidney stones since then, but he toughed it out. Some of you, especially if you're going into nursing or again, physical or occupational therapy, will have patients that need to have catheters. So what are the times that people have to have a catheter? Why would you? They can't control urine. What were you going to say? If they're retaining urine, they can't get it out. The other time is if you're going to have surgery and they don't want you to get up and walk to a toilet. So those basic times. So a catheter, if you're not familiar with this yet, it is a tube to drain urine continually. Into some kind of container. And normally this would be a bag under your hospital bed. So nursing students, you will learn to insert catheters, which is one of the most things to me. But you put a tube up through the urethra, And once the tube is in place in the bladder, there is a little balloon that you inflate out on the end of it so that the catheter is going to stay where you put it. So these can be called balloon catheters. So one good thing about short female urethra is it's a 4-centimeter threading process. Male urethra, it's a 20-centimeter threading process, which sounds awful. Are people awake when you do this?
I would hope not.
I thought so.
They are.
Like I had them when I had C-sections, but that was kind of not really what I was thinking about at the time. But they stay in a certain amount of time. They have to be changed often so that you don't get microbial colonization. But having catheters is going to increase UTI risk definitely by having something inserted up through the bladder. And so this side would be attached. These are really short. I feel like they need some more tubing there so that the bag can go under the bed. Those are urinary catheters. And when you tell the patient, do not take this out, it's because it's got the balloon inflated. So if you had one yet, try to take it out and.
Oh, yeah, they do it all the time. I just try to rip it out.
Oh, gosh, terrible. Okay, so now we're going to go back and look at kidney anatomy. And remember, the kidney has a huge blood supply because it's filtering blood, is its main job. So as it filters blood, as they filter blood, they are going to also make urine. So I want to start kind of in this region of looking at what's going in and out of the kidney. So we've got renal artery bringing blood in, and then like a lot of branching of blood vessels all through the kidney. And then we have renal vein bringing blood back out of the kidney. So the blood that comes out, if our kidneys are working well, that should be filtered / rebalanced if our kidneys are doing their job. And the other structure that is kind of heading out of the kidney is the ureter. So we have blood going in and out, but urine only goes one direction, which is out. And all of these big vessels are kind of heading into one specific area of the kidney right here in this dented in part called the hilum. We'll have this next Tuesday in lab, kidney stuff. So when you're looking at kidney, the cartoons and the kidneys that we dissect in the lab and the models and everything, they have a color coding. And if you see that there is a structure in the kidney that is yellowish or whitish, that is part of the urine drainage system. So kidneys, when you look at them, you've kind of got like the blood part of it, and then you've got the urine drainage part of it. And this tan, yellowish, whitish color means that that structure is part of urine drainage system. And the parts, the little units of the kidney that do the filtering are out here in this region, out on the edge or out in the cortex of the kidney, and they are called nephrons. So this thing that looks like a mess, this is a nephron. And make a note, these are found in the cortex layer of the kidney, and you have thousands and thousands and thousands of individual nephrons that look like this. Okay. So I really vividly remember the first time I saw this, it would be about 14 years ago when I first started teaching AMP2, and the first time I was teaching it, I was about 3 days ahead of the students by this time of the semester, so I thought I better start looking at this kidney stuff. And I, looked through the paper book, and I came to this, and I thought, what in the world? That does not look like life structure. That just looks like a mess. There's a reason it is this way, and this is like a lot of micro anatomy. So I want to go through some of what this is, just the names and how you find the parts. So we're going to start with the blood system. Okay, so let's go backward a bit. So we have renal artery coming in with red blood, renal vein coming back out with less oxygenated blood. And as those vessels come into the kidney, they start branching. And they will branch like branches of a tree until they get out to this outside region called cortex, where the nephrons are. So when blood comes into a nephron, it's coming in through this structure right here, which is a little artery. And then it branches off this little branch called afferent arteriole right here. And then there will be a twist of capillaries, or like a capillary knot where they're joined together. That section is called glomerulus. So a glomerulus is a twist / knot of capillaries. And that's where filtering is going to happen, at this glomerulus. And then the blood comes past the glomerulus out this section called efferent, like exit, efferent arteriole. And then it starts to do this branching, twisting path up in here. And then there's a loop that dives down and so on. So up in this section of capillary up in here are called the paratubular. So if you draw like a bracket thing here, right here, these capillaries up in here are called perimeter, peritubular capillaries. Oh, they've got it labeled down here. So all of these capillaries around in here, paratubular, and then eventually the blood will go through all of this twistiness and come back out through a venule and then a vein. So blood comes in, goes to the glomerulus, comes back out of the glomerulus, does a lot of twisting around in this region, and eventually leaves through a vein. If you've got this picture right here, that this blood is unfiltered, that came in here, unfiltered, next to the red, and by the time it leaves, it ought to be filtered. And the reason that the blood takes this crazy, twisty, loopy path is because the longer the path, the more time it has for filtering and rebalancing. The twistiness is good, the time it takes is good because it gives you time to do the filtering and the rebalancing. So that's the blood system. Next, we're going to look at tubule system, which is the yellowish, whitish stuff. And the tubule system has a start. So the blood is just doing a continuous loop all the time. But the tubule system has a start, and it starts right here with this structure called glomerular capsule. The glomerular capsule, and it looks like a C in this shape. Glomerular capsule is kind of like if you've gone to get your hair done and then they put you under that bonnet dryer, they put it down over your head like this, and it's going all around your head, and it's got like a space inside for your head to fit. That's what a glomerular capsule is like. So it's like a hat that is fitting around the glomerulus capillaries, are like a head. So we've got blood supply here. This structure that kind of fits around it, that's glomerular capsule. And then from there, there's the start of these tubes. So there's one called proximal convoluted tubule, and that's close to the beginning, so proximal. Twist, 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 and then it goes down into this loop. Down and up. And that loop is called nephron loop. The old name for it is the loop of Henle. So kind of like Sam Henle, but without the Y. Loop of Henle with no Y. Down, 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 and up. And then that tubule will start to twist around again. And that section is called distal, because it's far away from the beginning. Distal convoluted tubule. And then it straightens out into a bigger, straighter tubule right here called collecting duct. This part is the collecting duct. And if you've got this picture, circle the word here, urine. So what we get out of the end of the collecting duct is urine that is finished. It's got what it's going to have in it. And that finished urine is going to move toward the center of the kidney, which is called the medulla. And then eventually head toward the ureters. So all of this whitish tubule network is starting to make urine by filtering stuff out of the blood. And all this twistiness is giving time for things to pass out of the blood, get into the urine. By the time it reaches here, whatever urine is there is finished. It's not going to change anymore, and it's going to head on out of the kidney and drain out. So finished urine kind of moves this way, outside to inside, and then it will head out the ureters there. And we'll start here on Wednesday. So I'm gonna stop the recording right now, and we're gonna go over exams.